All right, good afternoon. Hope you had a semblance of a weekend. And just remember to mute your mics and send out video and audio whenever you want to ask a question. The World Health Assembly, bringing together delegations from all WHO member states, opened a 2-day virtual session today. Speaking at the opening, the Secretary General said that despite the enormous scientific and technological advances of recent decades, a microscopic virus has brought us to our knees. The fragility exposed by the virus is not limited to our health system, he said, stressing that COVID-19 must be a wake-up call. It is time for an end to this hubris, he said. The Secretary General added that our deep feelings of powerlessness must lead to greater humility. The Secretary General reiterated the need for a 3-point response. First, he said there is a need for a WHO-guided, large-scale, comprehensive health response that emphasizes solidarity towards developing countries. Second, he said the UN has called for policies to address the devastating social and economic dimensions of the crisis. He underlined that unless we control the spread of the virus, the economy will never recover. Third, the Secretary General said that the recovery from COVID-19 must lead to more equal, inclusive, and sustainable economies and societies that are stronger and more resilient. He also paid tributes to the frontline health workers. The Secretary General added that the entire United Nations family stands with our WHO colleagues who are working around the world to support member states to save lives and protect the vulnerable. The WHO is irreplaceable, he said, calling for enhanced resources to support developing countries. The Deputy Secretary General, Mina Mohammed, gave a virtual address to the commencement ceremony yesterday for the Fletcher School at Tufts University in Massachusetts. She added that the graduation is virtual because our lives have become virtual. We are living them online. The COVID-19 pandemic has stripped everything back to the bare essentials, Ms. Mohammed said. As the new normal means finding ways to be together and keep our spirits high, she said the COVID-19 pandemic is causing enormous suffering, and the measures to contain and overcome it are testing societies to the breaking point. The Deputy Secretary General said our response must match the scale of the crisis and must be based on unity and solidarity with the United Nations at its forefront. Business as usual is over, she told the graduates, and the status quo is over. The question is what will replace it, and that, above all, is up to you, she told them. Tomorrow morning at 10 a.m., the Economic and Social Council's annual operational activity segment will start. For the first time, it will meet virtually. The Secretary General will be the keynote speaker in an interaction with member states. The event will be opened by Mona Juul, the permanent representative of Norway and current president of ECOSOC. The vice president of ECOSOC, Juan Sandoval, who is the deputy permanent representative of Mexico, will moderate the opening session. The discussions will focus on the importance of coordination among UN teams, which cover 162 countries and territories, nearly a year and a half after the launch of the UN reform in the development sector. The COVID-19 pandemic more than ever highlights the need to coordinate the health, humanitarian, socioeconomic response, and recovery. You can watch the opening session online on webtv.un.org. And Geir Peterson, the special envoy for Syria, briefed members of the Security Council this morning on the situation in that country. He noted relief among Syrians that the COVID-19 pandemic has so far not hit the country at the scale initially feared, but also fears that it still could do so. He said that he senses a deep anxiety over the fact that even if violence has for the moment somewhat abated, it does continue and it can escalate at any moment. In the northwest of Syria, Mr. Peterson said this month saw further progress in Russian-Turkish cooperation on the ground, pursuant to the March agreement that brought relative calm to Idlib. He expressed hope that this bodes well for sustaining calm there. However, he added, violence continues and there is a constant risk of escalation which could unravel existing arrangements. Mr. Peterson said we must at all costs avoid reversion to the all-out fighting and abuses and violations that we had seen in the past. The Emergency Relief Coordinator, Mark Lowcock, will brief the Security Council on the humanitarian situation in Syria tomorrow. Excuse me. And in a statement we issued over the weekend, the UN Assistance Mission in Afghanistan, UNAMA, welcomed the agreement reached between President Ashraf Ghani and Dr. Abdullah to resolve the political impasse and enable the leaders to address the grave challenges facing the country. For his part, the Secretary General is encouraged by the leaders overcoming more than 2 months of political impasse and finding a way forward based on compromise, dialogue, and inclusivity. It is his hope that the agreement between the President Ghani and Dr. Abdullah as head of the new Council for National Reconciliation can enable progress towards intra-Afghan negotiations and a comprehensive peace agreement, as well as addressing the challenges of the COVID-19 response and other development and humanitarian needs in Afghanistan. Over the weekend, the Secretary General welcomed the arrest in Paris of Félicien Kabuga. He had been of Rwanda. He had been sought since 2013 by the International Residual Mechanism for Criminal Tribunals for Genocide and Crimes Against Humanity, allegedly committed in Rwanda in 1994. Mr. Kabuga's apprehension sends a powerful message that those who are alleged to have committed such crimes cannot evade justice and will eventually be held to account, even more than a quarter century later. The Secretary General's thoughts are first and foremost with the victims of Mr. Kabuga's alleged crimes, the victims of other serious international crimes, and their families. Mr. Kabuga, among others, ran the Radio Mille Collines. Ending impunity is essential for peace, security, and justice, the Secretary General said. And in a statement on the upcoming elections in Burundi, the African Union Commission and the UN expressed their concerns about reports of intimidation and violent clashes between supporters of opposing sides. In a joint statement, they called on the country's authorities to provide a safe and secure environment to allow Burundians to exercise their political and civil rights in tolerance, peace, and mutual acceptance. The UN and African Union Commission encouraged all entities involved in organizing the May 20th elections, the defense and security forces, and state-owned media to fully contribute to preserving a stable and peaceful environment, a prerequisite for free, inclusive, fair, transparent, and credible elections in Burundi. The two organizations also jointly urged all political leaders to refrain from all acts of violence and hate speech and resort to dialogue to enable the holding of consensual and peaceful elections. They also encouraged the Burundian authorities to ensure and facilitate the full participation of women during this electoral process. And in the Central African Republic, the UN peacekeeping mission there tells us they have launched two major operations in the country's central region. In Ndelele, following violent clashes we reported on at the end last month, peacekeepers are working with the Central African Armed Forces to protect civilians and restore safety in and around the city, notably to facilitate the resumption of humanitarian activities, in particular for those who have fled homes. A rapid intervention unit dedicated to large-scale operations on the ground, as well as detachments of UN police officers deployed to support the investigations initiated, also to contribute to the overall security in the city. The second operation has been deployed in Sibut-Grimari-Kwango Triangle and aims to end the illegal activities of a criminal group, to strengthen the protection of civilians, and to ensure the freedom of movement along the main roads. Despite these additional challenges posed by the COVID-19 pandemic, the peacekeeping mission in the Central African Republic remains committed to fully exercise its mandate. And a few items from our country offices as they continue to mobilize in the fight against the pandemic. From Kazakhstan, where there are 6,400 confirmed cases of COVID-19, the UN team, led by the resident coordinator, Norimasa Shimamura, has been supporting the government's emergency health, risk communications, and the socioeconomic response. WHO's training sessions, healthcare workers on infection prevention and control, case management, and laboratories. It has also provided personal protective equipment, hygiene kits, and test kits. The UN team As you'll recall, the Secretary General recently launched a policy brief on the impact of COVID-19 on mental health, and the UN team in Kazakhstan is spotlighting the importance of mental health in all its communications campaigns, webinars for healthcare workers, education facilities, and civil servants. For example, the number of people using the special national website on mental health support, which was developed jointly with the UN Children's Fund, has increased 40%. Also, UN staff members have donated essential COVID-19 supplies, including food, hygiene kits for more than 80 families in several regions of Kazakhstan. And in Somalia, our humanitarian colleagues tell us that the COVID-19 is affecting lives and other livelihoods amid other complex humanitarian crises. As of today, 1,421 cases of the virus have been confirmed in Somalia, with 56 deaths. Somalis are also dealing with floods and the worst desert locust upsurge in 25 years, along with protracted conflict and significant displacement. Our humanitarian partners and authorities are scaling up flood responses and have reached at least 182,830 people with humanitarian assistance. Funding for humanitarian operations in Somalia, unfortunately, remains very low. The revised 2020 Somalia Humanitarian Response Plan is less than 17% funded at $210 million out of $1.25 billion. And in a message marking International Day Against Homophobia, Biphobia, and Transphobia, the Secretary General said that the increased vulnerability of LGBTI people is one of the many severe impacts of the COVID-19 pandemic. LGBTI people already face bias, attacks, and murder simply for who they are or for whom they love. But they are now experiencing heightened stigma due to the virus and new obstacles in seeking healthcare. Mr. Guterres noted that there are also reports that police are misusing COVID-19 directives to target LGBTI individuals and organizations. He said that as the pandemic unfolds, the United Nations will continue to highlight these and other injustices, as well as the need for everyone to be protected and included in the response to the crisis. And today marks International Museum Day. And according to friends at UNESCO and the International Council of Museums, nearly 90% of them, or more than 85,000 institutions, have closed their doors for varying lengths of time during the crisis. Nearly 13% of museums around the world may never reopen. In a tweet, the Secretary General said that museums may be temporarily closed, but they remain a source of knowledge and discovery for many, particularly through virtual tours. He also thanked museum workers for their valuable contribution. And the UN Food and Agriculture Organization is seeking $350 million to scale up hunger fighting and livelihood boosting activities where COVID-19 impact on the food crisis could be devastating. FAO's funding request is about 3 times more than late March as COVID-19's staggering socioeconomic impact become more evident. According to FAO, even before the pandemic, 135 million people were experiencing crisis or worse levels of acute food insecurity. FAO's humanitarian response to COVID-19 is part of the global COVID-19 humanitarian response plan. And lastly, I just want to say that we are very sad to learn that longtime UN correspondent Don Paneth passed away last month. We send our condolences to his families. We will all remember him for his amazing memory of events that unfolded at the United Nations over the last 75 years. From the opening of the UN in New York in 1945, which Don covered for the New York Times, to Security Council votes before the Iraq War, which he reported for The Independent, a progressive newspaper in New York. Don was a passionate defender of the potential of the United Nations. We last saw him not too long ago in our offices in his trademark seersucker suit. We had a passionate conversation about the situation in Syria and the Security Council's work. Talking to Don always helped us remind us of what the United Nations can be when we do our best. We will try to remember his idealism as we face the challenges that lie ahead. Don Paneth was 93. And with that, I will stop here and try to take your questions. And Stephanie is in the room. We will start with
Ladies and gentlemen, please stand by. Stéphane Dujarric got disconnected. He has to dial back in.
All right, here you go. I can see Celia, which is always a good sign. All right, Beitul, let's go back to you. Or Edie? Edie?
I'm here.
Excellent, we're back.
Good. Thank you, Steph. And on behalf of the United Nations Correspondents Association, our deepest condolences to Don's family. He's certainly left an incredible legacy at the United Nations in his reporting. I had a question about Libya because of this bombing over the weekend at a center for the displaced. And my question is what the UN might be doing, and can you update us on the progress in trying to find a new SRSG for Libya? And also, any chance that we might get to talk to the Secretary General anytime soon? There's a lot happened since we talked to him last. Thank you.
We continue to, well, we'll see when we could schedule something with the SG. Not very likely this week, but we could try for the following week, but we'll keep you posted. Obviously, we're very much aware of the continuing violence that we've seen in Libya, which continues to be scandalous, frankly. Is the most vulnerable that continue to suffer. Civilians, refugees, migrants, healthcare facilities are attacked. Civilian infrastructure is attacked. Our message to all the parties continues to be the same, which is stop the violence, put the guns down, and resume the political process. As far as the search for a new SRSG, it is very much in progress. You know the system as much as I do. As soon as we have something to confirm, we will. But I can tell you, it is very much ongoing. Beitul?
Hi, Steph. Thank you very much. I've got two questions. Firstly, what does the Secretary General think of Taiwan's exclusion from the World Health Assembly? It has obviously been very successful in preventing the spread of coronavirus. And secondly, the Secretary General has been calling for a global ceasefire since the beginning of the pandemic, endorsed by the Security Council, but the Security Council is paralyzed once again due to a disagreement over the World Health Organization. I just wanted to know if the Secretary General thinks that whether the World Health Organization should be mentioned in a Security Council resolution or not. Thank you.
Look, it's not the Secretary General's business to tell council members what should be or not be in a resolution. We would very much appreciate strong backing for the Secretary General global ceasefire call from the Security Council, the institution within the United Nations charged with peace and security. I think a strong message from them would go a long way. We understand the discussions are ongoing. We wait to see the results. On the issue of Taiwan, I think the World Health Organization is an independent agency. It is up for those member states to decide, and for the Secretariat, we abide and come under the relevant General Assembly resolutions on China. Let's go to Majid.
Thank you, Stéphane. I have a question on Syria, on the issue of severe lack of humanitarian and medical aid to northeast Syria. As you probably know, the World Health Organization and other UN humanitarian agencies are working directly with the Assad regime and the opposition groups. For example, last month they delivered more than 1,000 of COVID-19 test kits to Syrian government and the opposition groups. But those UN agencies, do not work with local authorities in northeast Syria. My question is, and they do work with Al-Qaeda-linked groups in Idlib, for example, other opposition groups. My question is, what is the logic behind this? Why the UN agencies, such as WHO, work with even Al-Qaeda-linked groups, but do not work with local authorities they were heavily involved in fighting terrorism and ISIS?
I'm not going to go I'm not equipped to go into the granularity of this issue. What I can tell you is that obviously we work with the government of Syria. We work with every member state. And as we do in places where there is conflict, where the state authority may not be fully extended, and that's whether in Syria or different countries, we work with de facto authorities, de facto groups that may be in control to get the humanitarian aid in.
But I understand. Sorry.
We work with whomever we need to work to get the humanitarian aid in, based on the well-known humanitarian guiding principles of the organization.
Just to follow up on that, question is, you do not work with the authorities, the de facto authorities in northeast Syria. While you do that, you're right. Other part.
I can't get into any more detail. What I can tell you is that we work with whomever we need to work with within the parameters of the UN's humanitarian principles to get the aid to those who need it. Celia.
Thanks, Steph. Do you hear me?
Yes, perfectly.
Yep. Okay. Thank you. Steph, the Venezuela issue has been brought up by Samuel Moncada to the Security Council. He sent a letter of 14 pages last week to the Security Council with a copy to the Secretary General. Today, the representative for Juan Guaido for International Affairs sent another letter. Is any reaction from the Office of the Secretary General of these letters coming to his office, and if this could jeopardize any humanitarian aid that is being agreed to be able to enter the country?
Look, I haven't seen letters. Well, we very much hope that nothing jeopardizes our humanitarian efforts. People who need to get help should get help, and that's what our focus continues to be. We do understand that there may be some discussions within the Security Council on Venezuela, and we will, as always, answer any requests we get from the Council presidency. Okay, let's see. Hold on. Somebody else had a question. Let me go back up. Abdelhamid. Abdelhamid?
Thank you, Stéphane. Today in the World Health Assembly, there's about 120 countries calling for an investigation of how the pandemic started. What are the thoughts of the Secretary General? Does he agree that there must be some kind of investigation how the pandemic started? That is my first question.
I would refer you to read his remarks, in which he said he expressed exactly his opinion, which has been the same now for a few weeks, that we will need at some point to do a look back to examine the role of institutions, of member states, and so forth, and how the pandemic is. But don't use my paraphrase. Read what he said today, and I think that will answer your question exactly.
Thank you. My second question. Yesterday, in a panel discussion, Mr. Mladinov spoke at the Israeli Institute for Regional and Global Policies. It's an NGO. And he spoke strongly about the annexation. I expected you to read what he said in this noon briefing. Did you read? Did you see?
Remarks, but as soon as we get them, we will put them out.
Thank you.
Okay, your colleagues at Xinhua had a question. At the World Health Assembly, China has committed $2 billion over 2 years for COVID-19 and has proposed working with the UN on a global response depot in China. Does the Secretary General have any comments? Well, we obviously welcome every expression of support, whether in words or in cash, to the World Health Organization and to the critical work it is doing in the fight against the pandemic. Evelyn, you had a question.
Yes, hope you had a peaceful weekend, Steph. A couple brief questions. On the Taiwan question, they had asked to be an observer, not a member, and do the General Assembly resolutions still apply? And secondly, on Brazil, you
on your first question, that's a question for the World Health Assembly. They have their own rules and regulations. I'm not qualified to answer that question.
Right. On the second one, on Friday, you spoke about Brazil, and I'm wondering how the UN staff there could do anything when the president of the country is undermining any meaningful steps to combat the virus, and the police are shooting people at random.
I think we gave a pretty detailed readout of what the country team is able to do. Obviously, as in a country, we work with the government. So what they are able to do, they would do in partnership with the government of Brazil. But I don't have any other update besides that.
But the government's divided. Health ministers quit. And so forth.
I understand the situation. We are obviously highlighting what we are able to do. Edie, you had another question.
Yes, I did. Thank you, Steph. I wondered, I think I had asked last week if we could get some kind of an update on the Secretary General's ceasefire call and exactly how many, we know perhaps the number of responses, but what exactly has happened as a result?
Sorry, my bad. I need to follow. I dropped the ball on that. Let me follow up on that, and I will help you. Dulcie says, I need an update on number of confirmed COVID cases among UN personnel and deaths, please. All right, Dulcie, what I can tell you, as of Sunday evening, May 17th, we have reported to us 520 cases globally. In the Americas, 147 cases. That includes 78 cases in New York. Of those, 78 cases in New York. And in terms of fatalities, I think that that number is at 7, sadly. 1 at FAO, 1 at UNICEF dependent, 1 UNICEF staff in Nigeria, 1 UNOPS consultant here in New York, 1 WHO staffer, 1 staffer from the World Intellectual Property Organization, and 1 from the International Residual Mechanism for Criminal Tribunal that we spoke about. Hopefully, you'll see that answers your question. Stephanie, any more questions? Okay, no more. Thank you all very much. We were coming to you today from UN studio, but we will be back at our undisclosed location tomorrow. And thank you, Edie, for those kind words about Don. Thank you, and we'll see you tomorrow. Signing off.